Greetings, everyone. Welcome to Listening for Change, Motivational Interviewing Techniques for Client-Facing Staff. Thanks so much for joining us. My name is Erin Mann, and I'm the Program Manager for the National Resource Center for Refugees, Immigrants, and Migrants, or NRC RIM. And I'm going to kick things off for us today. For those of you not familiar with NRC RIM, we're funded by the CDC to support health departments and community-based organizations working with refugees, immigrants, and migrants who have been disproportionately affected by COVID-19. Here at NRC RIM, we offer a wide range of resources, including promising practices, guides and checklists, training resources, and a growing collection of health communications resources that have been translated into about 40 different languages. For example, we have fact sheets and conversation guides and other resources that are really geared to help support conversations with clients. We're going to share a list of those links and resources via email to everyone who registered after today's event. NRC RIM is housed at the University of Minnesota, but we're really fortunate to work closely with several core partners, including the International Rescue Committee. Our colleagues at IRC have done a tremendous job organizing and planning this event, so a big thank you to them. One quick housekeeping item, as we go through today's session, please feel free to put your questions in the chat. Those will come to our team of panelists and organizers. I'd now like to introduce our moderator for today. Dr. Beth Dawson Hahn is an assistant professor of pediatrics in the Division of General Pediatrics at the University of Washington. She's also a medical advisor to the CDC, specifically within the Division of Global Migration and Quarantine, Immigrant, Refugee, Migrant Health Branch. In her role with CDC, we've been fortunate to work closely with Dr. Dawson Hahn here at NRC RIM. And with that, I will turn it over to her.
Thank you so much, Erin. Thank you to everybody for being here today. I am mindful that we are coming to the close of the year, that we're in a period of reflection of the number of lives that have unfortunately been lost in the US, up to 800,000 people we anticipate, as well as 500 million people around the world. I imagine that it is at the forefront of all of our minds to figure out how we can prevent more deaths from this ongoing pandemic and to continue to build skills both within and beyond this pandemic to be more effective listeners for change. And so I'm really glad to spend this time in conversation with you all. We're really lucky to have the time of some incredible experts, and I'd like to take a second to introduce them to you. One of them is Dr. Nushin Aminuddin, who is the chair of the Diversity and Inclusion Council at the Mayo Clinic Health System, an assistant professor of pediatrics and a consultant at the Mayo Clinic, and the chair of the American Academy of Pediatric Council on Communications and Media. Dr. Aminuddin is an incredible advocate for children and someone from whom I've learned a lot about how to be an effective communicator, and I'm really excited for you to learn from her today. Dr. Anisa Ibrahim is the medical director of our clinic at Harborview Pediatrics, an associate professor of pediatrics at the University of Washington, the former board president of the Somali Health Board, and a member of the American Academy of Pediatrics Council on Immigrant and Child Family Health. She is someone for whom partnering with children and families is at the heart of her work, and thinking about how we bring community into our work is ever present in our minds when we're in her company and hearing her expertise. Pamela Silberman is the health program manager at the International Rescue Committee in Salt Lake City. And in this capacity, she oversees a whole range of programs that promote access to primary care, health promotion, education, mental health assessments, and really in all of her work, thinking about how we can bring community outreach into improving the lives of refugees and immigrants who are living in Utah. And finally, I'm excited for you to meet Dr. Pennant Duke, who is a resident physician at the University of Washington and a member of the Keimer Community of Seattle and King County Health Boards. He finds joy in the opportunity to work alongside the community in ways that center community voices and ownership, and enjoys mentoring young people, embracing untold stories and histories, and it is an incredible clinician and leader, someone for whom I'm lucky to learn alongside in our clinic at Harborview Medical Center. So with that, I will let you learn more from them over the course of our conversation today. I'm going to be passing things over to Pamela Silberman to share with us about motivational interviewing techniques. And from there, we will have a moderated panel discussion, followed by some opportunity for you to utilize these skills that you likely already have and will be polishing later on for about 20 minutes, and then we'll come back together to reflect. Thanks again for being here. Please feel free to put questions into the chat as we go forward. Pamela, I'll pass it to you.
Great, thank you, Dr. Dawson Hahn. Good afternoon, everybody. Thank you so much for joining us. I am really honored to be a member of this impressive panel and want to appreciate the work of both NRC RIM and the IRC that we've been doing throughout the pandemic. I am the health program manager in Salt Lake City for the International Rescue Committee, and we have been working since pretty much early on in the pandemic to respond through outreach, education, access, and emergency response to refugee and immigrant clients in Salt Lake City that are confronted with the impacts of the pandemic. We have a team of 6 members, a couple of whom are on today on the call. We have a COVID response coordinator and then 5 other outreach assistants, all of whom come from either a refugee or immigrant background themselves. And obviously early on, we were focused on educating around the pandemic, around coronavirus, wearing masks, social distancing, what quarantine was, also providing access to testing. And then as the vaccine became available, starting to educate on the purposes of the vaccine, what it does, how protective it is, and how people can access. We have also been doing response throughout in terms of access to emergency food and rental assistance, utility assistance for refugee and immigrants in our community. And we've worked closely with both the Utah Health Department and the Salt Lake County Health Department in these efforts. And we've been very fortunate to have great collaborations with them and access to data and information that a lot of states don't have the ability to access. Okay, now I'll go to the next slide. So we're going to talk about motivational interviewing today. I just want to give a little bit of background on how we got to this point of using motivational interviewing. So of course, early on, we really saw ourselves as providing information. As Dr. Dawson Hahn mentioned, the NRC RIM, part of the focus has been developing information in a variety of languages, videos, fact sheets, different modalities so that we could reach folks, whether it's through WhatsApp, whether it's through phone calls. And that was great at the beginning when we knew very little about COVID-19, and also when the vaccine wasn't available and there were so many questions. About maybe 3 months ago or so, as we saw refugees, those that wanted to get the vaccine, that we've had great access to it, and then we started to see the folks that are really on the fence are receiving it. And that's when we decided that we needed to change the way we were talking with people. Now, in the IRC in Salt Lake City, we are resettling about 1,200 individuals this year. Right now, the vast majority coming in are the Afghan evacuees. And most of those folks are coming from military bases where they've been for a while and they've received the COVID-19 vaccine. But refugees coming directly from other countries, the majority of whom are coming from Central Africa, Iraq, Sudan, some Burmese, a mixture of individuals. We've had North Koreans coming in, a big mixture of individuals, haven't had access to the vaccine and haven't had access to good information. We are seeing a few coming in partially vaccinated with one of the WHO approved vaccines, but most are not vaccinated. And so what we decided to do was to focus on motivational interviewing, which is really a technique to explore motivation and where people are coming from and what their attitudes and questions are in order to hopefully enhance behavior change. And some of the core principles about motivation interviewing is focused on autonomy, not pushing people to do something, whether in this case being vaccinated against COVID-19, but really respecting people's autonomy. One of the things that was shared with me early on, I went to a a community meeting of Congolese community members, and they talked about how in refugee camps, they're just vaccinated without any choice and not being told what even the vaccine is for. And so a lot of hesitancy comes from this idea that people want autonomy. They want to make a choice. They want to know what's being put into their bodies and what's being put into their children's body. And so I think that's a really core piece, is to respect individual autonomy. Also collaboration. So often, those of us in the healthcare sector, whether we're providers and physicians or public health professionals, we're seen as experts. We see ourselves as experts. And so we're often in the position of telling people, but not necessarily asking people. And I think it's really important to be collaborative in this way. Our clients are experts in their own life experience, and trying to develop a respectful partnership is really important. And then finally, curiosity. What motivates people, and what do people think and feel, in this case, about the vaccine and about the pandemic? And so only by listening and asking questions can we understand that. And I think for me, that's one of the things I love about motivational interviewing, is I am a very curious person. I am interested in people's stories, and this allows me to understand how their stories and their opinions explain some of the choices that they make. So motivational interviewing relies on these 4 skills or techniques with the acronym ORS, as you can see. So the first is asking open-ended questions, right? A yes/no question doesn't get you very far. And so really asking questions about, you know, what are your thoughts? Why do you feel that way? What have you heard? What have people told you? Those kinds of things that allow people to expand upon where their opinions and their ideas come from. The next piece is the affirmation. So we don't have to agree with people, but we do want people to be heard, understood. You know, if somebody says, for example, that, you know, they think the vaccine will make them infertile, you know, your tendency might be to say, well, that's not right. But that really shuts down that conversation. And so another way to approach it is to say, you know, a lot of people have heard this, and that's probably very scary for you if you're planning to have children. Let me tell you what I know about this. And so it doesn't validate a misinformation, but it validates someone's concerns. And I think that's important. We don't want to validate misinformation, but we do want to validate where people are coming from. The next piece is reflection. And, you know, again, this is very common in any kind of, you know, intentional listening practice, is to reflect back what people are saying to you, to make sure that you're understanding correctly. So if a client says, you know, I hear when people get, you know, I heard people have died after they got the COVID vaccine, you can say, yeah, that's a common concern, and that's probably scary for you. But, you know, is that what you're afraid of? Is that what you do know someone who's had it? Again, sort of reflecting back and trying to understand where someone's coming from. And then the final skill is summarizing, which is similar to reflection, obviously. But this is really at the end. And I think this is very important when you're working with interpreters, when you're not speaking the same language as the person you're speaking to, because it's a chance to make sure that you've heard the person correctly, and also to let them hear it themselves. Oftentimes, somebody, especially if they're talking about things they've heard but haven't experienced themselves, and you summarize that back, it gives them a chance to say, is that really what I think? You know, why do I think that? And so the summarizing is really important when you're working with non-English speakers. Next slide. So we've used motivational interviewing during cultural orientation, and cultural orientation is what happens at 30 days when folks have newly arrived in the United States. They attend a day-long session where they get a lot of information about what to expect in the resettlement process. And so this is what we've done is when we go in for the health portion, rather than, again, sort of lecturing on the vaccine and why people should get it, we really have a dialogue with clients, asking who's received it, why they chose to be vaccinated, those who haven't received it, what are their concerns. And oftentimes we don't really have to talk that much. Clients speak to one another and share their own experiences. And I think that's really helpful, again, in us stepping back as the experts. And so we spend a good amount of time answering questions and really trying to get it where people are at. At the end, we ask who would like to receive the vaccine and tell them we'll make an appointment. We ask for those that don't want to get it yet, we ask them if we can call them back in about 2 weeks and see how they're feeling. And then I just wanted to share very quickly, and I know my time is almost over. Next slide. A quick kind of case study with a client. At cultural orientation, the first time I spoke with him, he just said he wasn't ready. The next time I spoke to him about 2 weeks later, he had talked about how his brother was required to get the vaccine in order not to lose his job. And his brother now felt that his DNA had been changed. And I asked him what that meant and how his brother knew that. And he said that he wanted to speak to his brother and find out what was going on. The third time when I spoke to him, again, maybe 2 weeks later after that, he shared concerns that he had received a concerning chest x-ray and wanted to resolve that before getting the vaccine. I explained that if he does have any kind of respiratory concerns, that getting COVID would be very dangerous for him. And so at this point, he remains unvaccinated, but I've learned so much in this process of these multiple conversations with him about where he's coming from and what his concerns are. And I think that's really the benefit of motivational interviewing, is you meet people where they are, you're listening and trying to understand, and little by little, he's revealed to me what his particular situation is. And then you target and you tailor. And so again, it's not a one size fits all. I'm able to address the particular concerns he's raised, asked him questions. This particular client is a very thoughtful individual. I think that he eventually will choose to be vaccinated, but he's needed to get, he's needing to get there himself, and not to be made to feel that there's something wrong with this process that he's going through personally. And so we have found motivational interviewing to be very useful. It is very time consuming. It's a one-on-one endeavor, but we feel that it really helps people feel respected and meets them where they are. Thank you.
Thank you so much, Pamela. I invite our other panelists, Dr. Aminuddin, Dr. Du, Dr. Ibrahim, to turn on their cameras to join us. I want to remind everyone attending, thank you for your presence with us today. Thank you for being in conversation. Please share your questions in the chat so we can make sure to tailor this to what's on your mind when we think about approaching people with whom we partner in care and service and in our community and families about vaccine hesitancy, vaccine deliberation, and the myriad of other ways we can use motivational interviewing. I wanted to start out by asking our panelists to tell us a little bit about times when you found motivational interviewing to be helpful, and what's been your experience in one of your many roles. Dr. Aminuddin, can I ask you to start?
Sure, absolutely. Thank you, Dr. Dawson Hahn, and thank you to Ms. Silberman for managing to condense motivational interviewing into a very digestible chunk of information. I really appreciated that. So the question is, like, when have I found it to be helpful? It's interesting. Like, I'm working with a family right now who I've known for many years, of taking care of all of their children. And it's interesting because one parent actually had a very severe case of COVID, was hospitalized, and the other parent, in our ongoing discussions, has been saying, yep, I know how severe COVID is. I think it's really important for adults to get vaccinated, but I'm just not sure about the kids. I'm just not sure. And so I think motivational interviewing has provided me with a framework, number one, to be able to kind of approach this in a non-judgmental way with her. You know, I don't have to scare her. Her husband was obviously in the hospital, so she knows, you know, how bad it can be. And I think it's also kind of, for me, been very helpful knowing that it's not a one and done sort of thing. It's a, you know, we meet once, you know, we'll meet next week for the next child's health maintenance visit, and to kind of just gradually help them along that path, and to say, okay, you know, like in terms of, you know, how motivated you feel, or how confident you feel. Because one thing I tell all my patients is that I want you to feel comfortable with this decision. I want you to be confident in this vaccine decision, because, you know, as much as I want you and your children to get vaccinated, and as much as, you know, I know the urgency of it, I don't want anyone to feel forced. And so I think for me, it's kind of helped to just, you know, take a moment, take a breath, know that this is kind of a long game that that we're working on.
Thank you, Dr. Aminadine. I agree. I think that the most important thing really for motivational interviewing for me as a provider is really building that initial trust, and then also ensuring that there is safe space created. You know, there is that they know that both patients and families know that this is a safe space for them to tell me whatever their thoughts are, and know that they won't be judged for it, and know that nothing on my end will change based on whatever they say, and then really affirming their concerns, right? Pamela was saying, you don't get far when you're like, well, that's an insane, you know, like that's a crazy thing. Why would you think that? Regardless of what the issue is, and knowing that most people are bringing up these concerns because they truly do believe it, right? Like they are truly concerned about that. And for me as a pediatrician, what their decision making is around one of the most precious things to them, and that's their children. So knowing that, you know, you're a great parent for thinking about these things, you know, I will be here to kind of walk this path with you, regardless of what you decide today, and that we will continue building trust and having these conversations. And please feel free to tell me whatever your biggest concerns are, no matter what anyone else's response has been to them. And then I think the active listening is really, really important after the validation. I think most families almost expect people to cut them right off as soon as they say, like, well, this is what I'm concerned about. And they are, regardless of what they choose, they're quite happy to hear from a provider. Just saying, I'm going to listen to you. I'm going to validate this concern, because what you're making a decision for is your baby. And I know you want to do what's best for your baby, or your, you know, or your loved one, or whoever that is. And you know, I will share whatever I have with you as well. And as primary care providers, I think what we are in a place where people do trust us. They come to us because they trust us, and using that relationship to kind of leverage the scientific knowledge that we have, creating a non-judgmental space, I think is one of the most important things we can do for the families that we're working with.
Thank you, Dr. Abraham. I absolutely agree with you about having that safe space, that open space. And I just want to say personally that I'm, you know, so incredibly honored to share this space with all the panelists and all our participants here. And it's just been incredible as well. And I think I want to approach this as well from like the perspective of the community, as someone who's been involved in the Khmer community here in Seattle and King County for many years. I think oftentimes we have this perception that those who belong to marginalized communities or marginalized identities have this mistrust of medical providers, mistrust of medicine and healthcare. As a result of that, we often try to approach. We want to offer the COVID vaccine because we feel like these communities are most impacted. But really, I also want to flip that frame of mind and reflect on ourselves as we have built the system in a way and have failed many of our communities and our patients and families over time. And that mistrust is the result of us. And so in approaching, I guess, vaccine deliberation, it's really going there with the ability and kind of the patience to build a relationship and be a trusted messenger if you're not a trusted messenger initially. And so how I approach this with my patient, and this is something I've learned from the shoulders of giants of community leaders and my own community, is really with kindness and really with understanding what parents are doing for their children And so I've met moms, I met fathers, I met parents who are working full-time, taking care of 3 children, and they're working so hard and they're just absolutely doing all they can for their children. And then I bring it up to them and it's like, how are you doing? What are you doing to take care of yourself? And then bringing up the idea of, gosh, I can't imagine what would happen to you if you were, wouldn't be able to work and support your family because of COVID, and how much your family has relied on you and how much resilience you have. But at some point, we all need that extra help, and that sometimes can be having that leap of faith or leap to like trust our providers that the COVID vaccine is something that is safe and effective as well.
Ms. Silberman, thank you so much for the really informative presentation. Do you want to build on that at all in thinking about this panel here and joining our other panelists?
I just want to appreciate what Dr. Tukes just said, that that the system has failed our clients in many ways. And I think the story that I shared about the experience of in the refugee camps of folks just getting vaccinated without any information is a good example. And I'm so impressed by the idea of providers really taking the time to listen to their patients, especially our clients who primarily are in Medicaid and therefore don't always have choices in their healthcare. We are very fortunate to work with providers who are have chosen to work specifically with refugees. And I do believe that we're able to give them a high quality of care. But I do think that there are barriers to this kind of active listening and engagement with our clients, patients. A lot has to do around like language access. If they don't have high quality interpretation or haven't valued interpretation, that makes it difficult to engage in a conversation. And so something that is often an afterthought for many providers, because they're focused on the medical aspect and not the communication aspect, is a huge barrier to this kind of active listening and really understanding where people are coming from. I know that in our community, we have, especially with some of the smaller languages, because Utah isn't as large or diverse as maybe some larger cities, Salt Lake, there are languages where there isn't access to interpretation. And we have had patients who've gone, we had one client that basically never had adequate interpretation in the entire 2 years that we were supporting her through case management services in her medical appointments. And that's really unacceptable because that means you have real inequity of care, because as an English speaker, I'm able to express my concerns, my thoughts, have a meaningful dialogue with my provider. But if there's no language access, a professional interpreter who can really do that, help me do that if I didn't speak English, then I'm not getting the same level of care. And I think that's a big barrier that we see.
I really appreciate you bringing that up. I think that that's something that the providers on this call will likely have more to build upon, thinking about what are some of these barriers in addition to language access, and then what are other potential barriers that have come up for you and how have you navigated them? Because I imagine folks on this call are thinking, I want to put this into practice, and how might I overcome some of those barriers?
We can start. I think, a lot of the barriers, I think over time have really just been getting the families comfortable enough to actually tell me what their true concerns are. And I think that that's on us, right? It's on us to build rapport and build trust. And it's also on us to explore a little bit about who they trust and where they can get the best message from. I always say that, doctors, regardless of their knowledge, are sometimes likely not the best messenger into communities, especially communities that have been historically excluded from these conversations and marginalized. It is community members, it is community leaders. So until you're able to build that trust with them, exploring with them, where do you get your information? Who do you trust in the community, so that you show genuine interest in really wanting to partner with them. And then I think as they have essentially seen more of me and have gotten to know me and have gotten to know the clinic, et cetera, they're more likely to kind of open up. I also think that, this concept of shared decision making is very, very American. And I think for a lot of our newcomers, it's a bit off-putting when we're like, when we're talking about many things and we're kind of like, well, what do you want to do? And they're like, well, I'm here for a reason because you're the doctor. So you tell me, and I think it can get confusing when, we want to input shared decision making about certain things. And then for vaccines, we're all of a sudden like, no, you should really get this vaccine, because I'm the doctor and I said so. And I know none of us on this call will do that, but I think it's just recognizing these cultural differences in the interaction of healthcare, especially the interaction of, preventative medicine and preventative healthcare, and knowing that we can be leading a confusing narrative if we're doing this shared decision making, and then all of a sudden we are making these strong recommendations. And then, I think even when we do back down and say, okay, like I respect your decision to, not do X, Y, and Z today, I think we have to really make it clear why we are saying that, right? I've had families say like, oh, I've had this doctor talk to me about, vaccines. And I was like, oh, I really don't want to do that. And then they were like, okay. So maybe it wasn't that important. Like maybe they didn't feel strongly about it. I'm getting kind of confused. So I think even when we do say, okay, I say something along the lines of, I really respect your decision, and I know that you want to do what's best for your daughter or your son. I hope that we can continue this conversation, during your next visit, because I really do believe that vaccines are really important and they're safe and they're effective. So we're not confusing families by just being like, all right, sure, if that's what you want to do. And then I think the cultural barriers. Just being inquisitive. And I think motivational interviewing really does help with that, just genuinely wanting to know. And the more that you genuinely want to know, the more that families are going to tell you. And they do pick up on, intentions as well. You as a doctor, like, why are you asking these questions? What are you going to do with this information? And being open and transparent about that.
And I just wanted to say I agree with what Dr. Ibrahim said. And it's interesting. Like I think there are two important points that have been brought up so far in this webinar. And one is that you want to validate concerns without validating the actual misinformation. Number two is what Dr. Ibrahim said about wanting to give people autonomy, let them know that this is their choice, without inadvertently saying, yep, it's no big deal, because that actually has come up a fair bit over the last decade plus of doing this, that when you're like, okay, it's your choice, or if a physician, for example, says, so do you want to do vaccines today, rather than these are the vaccines your child is due for today, and kind of a semi-authoritative, but but also still parents are always going to be the ultimate decision makers for their children. It's interesting because that really does have an impact. And so when you as a physician say, nope, this is something I really feel strongly about, and here's why, that does make a difference. And the other thing we've noticed is, and I spent a fair bit of time looking at misinformation and disinformation, which is actually intentional misinformation, which is a huge problem, not just for our communities, but really a huge problem worldwide right now about health, politics, you name it. But it's interesting, and this is another thing we learn in communications, that we should not repeat the misinformation, even to debunk it, because that can actually, studies have shown that will reinforce the misinformation, and people will remember the misinformation rather than your debunking of the misinformation. So I know that's not motivational interviewing, but I think it's an important concept that we need to keep in mind. It's a very fine line to walk on both of those, but one that with practice, and hopefully you'll get to do some of this in the breakout sessions, that you can effectively kind of focus on the positive without inadvertently reinforcing mis or disinformation.
I also just want to add to what's already been beautifully said, is the cultural barriers are certainly tricky depending on what's available and what resources are available for a certain community. And what Pamela Silberman was saying with the translation means more than just the word-to-word direct meaning from English to whatever language for the patient at hand. It's also a cultural translation that we need to focus on. And I can certainly have that opportunity to do that for the client community, but I can't say I can do that for other communities as well. And so just being mindful of our own deficit or our own inability, and really resting on and relying on partnership with other community navigators as well. And I also just want to expand on the idea of building partnership, avoiding the transactional relationship even after the COVID vaccine is given, right? Acknowledging the fact that you will still be there for your families and your patients even after they have gotten the COVID vaccine, because a lot of that deliberation of vaccine comes from what would happen afterwards. What if I get a fever? What if I'm sore? What if I'm not able to work afterwards? And so recognizing that is a very real feel of not being able to be there for their family or work or support their families after the COVID vaccine, and just finding ways to support that.
And I'm just going to jump in really quick. Dr. Tooth, you brought up a really, really important point. I've had parents through the process of motivational interviewing who share, I want to make sure my child is vaccinated, but I have to work tomorrow. I need to make sure I have like a day off work in case my child has a fever. And that's a very real concern because daycares won't take them if they have a fever. There's just so much that goes into it. And so it's like, okay, we're here. Let's work on this. Let's set up a time when you know your schedule and we can make sure your child gets vaccinated. So yeah, very real concern.
I really appreciate you bringing that up about the families. It's a nice segue to thinking a little bit about motivational interviewing across generations. I feel like that's something that comes up a lot in clinic visits. It comes up a lot with clients when we think about celebrating the multi-generational families we get to partner with in care and we get to work with in the communities that we care for and with our neighbors. So I'm curious if you think about this differently when you're talking across generations, or do you approach it in the same way? And then maybe I guess an additional question is, if people in different generations are at different points in their decision making, how do you think about that?
That's been really interesting for us because we've definitely had families where, for example, the older children, so before 5 to 11-year-olds were able to be vaccinated, the older children were wanting to be vaccinated, the parents were not, and really trying to understand the perspectives of each of them. And in some cases, the parents, which seems counterintuitive, the parents were kind of like, well, let's see how it goes for the kids, and then I'll decide what I want to do. And I think part of it is they also, as was mentioned with work and flexibility, kids have a little more flexibility because if they're older, they can stay home from school on their own. I do want to reiterate that has been, I think, a frustration for us in this whole process is, if I think about myself, right, when I scheduled my vaccine doses, I planned it when I knew I could be off the next day, whether it was because I could take a paid day off of work or, have it on Saturday. And in fact, I haven't even had my booster yet because I don't have a day that I can have for recovery. And our clients aren't necessarily in those kinds of positions. And so again, this idea that understanding unique barriers that these individuals that we're working with face, and that whether they're cultural barriers, whether they're economic barriers, whatever they might be, I think is incredibly important because, we often make assumptions that people's situations are the same as our own, and we have to really be careful about those assumptions. But getting back to the question, I think it has been interesting to see the varying ages across families with the choice. And I think one of the things is, as you're talking with folks, say, oh, I know your kids got it. Can you, tell me how it was for them? And, does that make you feel more comfortable, like utilizing that cross-generational piece to help see if that promotes comfort for the individuals?
I think with cross or like intergenerational motivational interviewing, I think the most important thing is really for me when I'm doing this across generations is to figure out when I'm thinking about the family in the bigger context. I think there is a very American definition of a nuclear family, and that nuclear family is not always the decision-making people within the global kind of family, especially in families who are immigrants here or in historically marginalized communities. So when I'm interviewing across generations, for me, it's kind of good to pinpoint out like who are the decision makers. So I often ask families like, who do you typically consult with when you're making a medical decision for your child? And that I can speak for my community. I know in the Somali community, community, it is, the mothers who are primary kind of like medical decision makers for, whether kids are going to get vaccinated or whether that's going to happen. But if it's something bigger, for example, I was a physician when my daughter was going to get her tonsils out. But regardless of, what I knew the decision was going to be at the end, it was very important to talk with my mother. And then she also talked with her mother just to kind of get that final blessing to be able to do this. And that interaction was really important. And I think that we should really put a lot of emphasis on the fact that we respect that interaction and the concept of, kind of mom and dad making the decisions for everything that the children do, even if that is what actually happens. There are many cultures who believe that more people should be involved, and we shouldn't really focus and limit our discussions to only the people who are the legal decision makers. And I think respecting that part of people's culture, again, garners more trust in the trust for you. And then also just the fact that you respect their cultural kind of decision making, but also the rules that they kind of need to follow for themselves. I think, one thing that I do is a lot of health literacy in and of itself is a part on the provider, and it's our job to continue teaching. So, I often talk about the legal decision makers versus like the cultural decision makers. And I think that both of those things are important. And I would love to talk to anyone who you think is, important in making this decision for you. So many times, I'll have dads who say like, you're definitely bringing mom next time, or can I bring grandma to the next visit, or can we have a phone call as a family? Sometimes it's, with vaccines, sometimes it's for something else, but I do think it's important to really think about that intergenerational, who else do we need to bring into this conversation to make it easier, so we're not playing phone tag with, a parent sending the message to the grandparent, or the parent sending a message to the aunt, or whoever's helping the family make this decision.
Everybody, we've had a couple of questions come in, and so I wanted to turn them over to our panelists. Dr. Duke, could you talk a little bit about how local health departments might approach messaging if they don't have personal relationships with people?
Absolutely, Dr. Dawson Hahn. I think that personal relationship can be built in so many different ways, but as a health department who's approaching it from the community base, the state level, that is an incredible challenge. And often here in Washington State, what we have noticed with our Department of Health is that they have partnered with ethnic-based organizations such as our health boards, such as the Combined Community of Seattle-King County organization, and basically invest in those organizations to do what's needed to build a relationship. And in doing so, we've been able to, at least through KCSKC, fund a few cultural navigator and community navigator to build that bridge, to build that relationship, to essentially combat, I don't want to use that word, but basically acknowledge and address the misinformation and disinformation that's going on within the community. And then after those relationships are built, allowing the Department of Health to invest in subcontractor to partner with these organizations, provide these vaccine clinic, these food distribution programs to reach where communities are at least with KCSKC and our health board, we've been successful in reaching our community. A couple of weeks ago, we've had a vaccine clinic and was able to reach nearly 300 people in a single day. And I think it's because of the incredible work of those who are in the community already.
Thank you so much. Dr. Munadine, could you share another technique that you had brought up, or a way of thinking about this relationship building with clients and families?
Sure. So I want to credit my colleague, Dr. Pranthik Saha, who's a pediatrician in New York and also certified in motivational interviewing, who shared this technique with a group of us just last week. And remember it as EPE, elicit, provide, elicit. So first, you're going to start by eliciting permission to talk about the subject. Can we talk about the COVID vaccine? And then if your client or patient says yes, you go on to provide a small, digestible piece of information for them. And then you follow up by eliciting feedback. What do you think about that? And so EPE, I think, is something that works very well in conjunction with the OARS that we've already learned, thanks to Ms. Silverman. And thank you, Dr. Dawson Hahn.
Absolutely. I want to just take a minute to thank everybody for attending today and being in conversation with us. A special thanks to our panelists, who are incredibly busy people working on the front lines of responding to the pandemic in a number of different ways.